Hi everyone, my name is Junsik, and with my lab partner Thomas, we'll be presenting about Lorlatinib, or its other name, Lorlatinib. So what is Lorlatinib? Lorlatinib is an anti-cancer drug treating non-small cell lung cancer, abbreviated as NSCLC. NSCLC is about 85% of all lung cancer, and ALK+, which stands for abnormal anaplastic lymphoma kinase, is type of NSCLC. And it is 3 to 5% of all lung cancer. Every year, about 72K people are suffering from ALK+, and it leads about 60K people to death. It is most prevalent in young patients below 50s, and it is not associated with common risk factors like smoking. It is especially effective in breaching the blood-brain barrier, or BBB, because it stays directly bound to a plasma protein in the bloodstream, allowing passage into the brain. It is used as a second or third line treatment after other drugs, and the reason for that is its side effect. Usually, drugs like Lorlatinib are used first for the treatment. Lavina's Euler stereochemistry allows it to inhibit the function of mutant ALK protein. It targets the ALK protein formed by the mutant ALK gene and stops overactivity by blocking the ATP sites.
Now we're going to talk about how lorlatinib works inside the body. This lung cancer is caused by a mutant ALK gene coding for a mutant ALK protein. ALK protein normally works for cell growth and inhibiting apoptosis, shown through the pathways in the photo. However, an overactive mutant could cause uncontrolled cell growth and the inability to perform needed apoptosis. Lorlatinib is a competitive ATP inhibitor, meaning it binds to the ATP binding site on the protein and prevents it from accepting additional ATP, which is needed to function. This neutralizes the protein. Lorlatinib also inhibits endothelial cells of the blood-brain barrier. This may explain its increased performance in the brain as well as its ability to cross this barrier. This is the structure of a mutant ALK protein taken from Protein Databank. The 6 brown residues make up the protein's binding site, while lorlatinib is in white. Lorlatinib binds to 13 residues in a protein, including 4 of the 6 binding site residues. As you can see, lorlatinib effectively blocks this binding site and is able to prevent ATP from binding to the protein. Lorlatinib binding to 13 different residues may also explain how it is able to anchor to the protein and effectively neutralize the protein. So why are we studying lorlatinib? Well, it's more effective than crizotinib, its predecessor. It has a stronger effect in shrinking tumors, a longer effect in patients over time, and more complete effectiveness in eliminating brain tumors. This may be because it can cross the blood-brain barrier much better than alternatives, specifically targeting these 3 genes, which are responsible for the permeability of the barrier. Lorlatinib can also treat mutants that are resistant to other drug treatments, as well as it may have the potential to treat other types of cancer that are of interest. Lorlatinib and crizotinib also have fairly similar structures, including these 3 rings and the stereocenter. However, lorlatinib has a more circular structure with this amide bridge, while crizotinib has this piperidine at the end.
So this is a total synthesis of lorlatinib and is a 5-step reaction. The first step is substitution. The 2 molecule is treated with calcium carbonate and methachloride at 50 degrees Celsius for 2 hours in our inert atmosphere. The second step is hydrolysis. The product from step 1 is treated with sodium hydroxide, water, and methanol at 50 degrees Celsius for 10 hours. The third step is amide reduction. This molecule is treated with hydrochloric acid, dioxane, and DCM for 0 to 20 degrees Celsius. The fourth step is amine acylation. The products from second and third steps are treated with DPA, HATU, and DMF at 80 degrees Celsius for 4 hours. The last step is intramolecular coupling. The product from step 4 is treated with palladium chloride and dioxane at 75 degrees Celsius for 4 hours in the inner atmosphere. So this is the air pushing for hydrolysis. The lone pair on the hydroxide attacks the carbonyl, and the lone pair on the oxygen come back down and it kicks off the methoxide, which forms the product.
Now we move on to reaction 4, an amine acylation using HATU. First, we start out with our first reagent and DIPEA. DIPEA deprotonates this carboxylic acid, forming this negatively charged oxygen. This negatively charged oxygen attacks HATU and uses this double bond to neutralize this positively charged nitrogen. This nitrogen then uses its electrons to reform the double bond, kicking off a leaving group, which is stabilized by forming this nitrogen-nitrogen double bond, and using this double bond to instead neutralize positively charged nitrogen. The negatively charged oxygen on the leaving group then attacks the ester, using this double bond to form a negatively charged oxygen. The negatively charged oxygen reforms its double bond, kicks off our leaving group, which forms a carbon-oxygen double bond, allowing this double bond to, again, neutralize this positively charged nitrogen. This forms a tetramethylurea leaving group, as well as a desired activated carboxylic acid. Next, our second reagent uses electrons on a nitrogen to attack the activated carboxylic acid group, and the double bond forms a negatively charged oxygen. This intermediate is stabilized by the coordination between this nitrogen and this hydrogen. The negatively charged oxygen reforms its double bond in the tetrahedral intermediate and kicks off the leaving group, forming a negatively charged oxygen. The negatively charged oxygen then deprotonates our amine. This leaves us with a final product, which can then be used to synthesize lorlatinib. Studying the synthesis of lorlatinib may be key to finding alternate synthesis and derivative drugs. There are ongoing studies into the drug's effectiveness on neuroblastoma, a type of cancer caused by immature nerve cells. In addition, as seen in the table, there is greater understanding of its side effects, and derivative drugs of lorlatinib may be able to counteract or eliminate some of these side effects. In addition, tumors can become resistant to drugs, so alternating drug regimens, including crizotinib, lorlatinib, and other derivatives, may be able to counteract this resistance. In addition, lorlatinib has been found to target other proteins as well, such as PYK2 and SRC. Both of these are also proteins that are related to the development of cancer. So in the future, derivative drugs of lorlatinib may target these proteins and allow treatment of more types of cancers. And finally, here are all the sources used throughout this presentation. Thank you for watching.